You may be saying, wait, isn't that manic depression? Manic depressive or manic depression are older terms, terms we used to use in the past to talk about bipolar disorder. But if you know those terms, yes, that is what we are thinking about and referring to as we talk about bipolar disorder now. Bipolar disorder really is a mental health disorder that's characterized by extreme fluctuations in mood. We're talking happy, high, yay, elated, and then down in the depths, depression, sad. These sort of fluctuations of highs and lows that can be very, very, very extreme. They can be chronic, they can be intermittent. So it can cause unusual, often extreme and fluctuating changes, not only in the mood, we talked about that, but energy levels, activity, concentration, and even focus. People with bipolar disorder have these sort of highs we call manic episodes, and lows, we call those the depressive episodes. So some examples of the manic episodes, including sort of feeling jumpy or wired, more active than usual, having racing thoughts, not needing sleep like they normally do, maybe talking fast about a lot of different things. We call that flight of ideas. Maybe an excessive appetite for things like food or alcohol or other different activities. And then just sort of grandiose ideas. These are sort of feeling unusually important, talented, or powerful. Again, not everybody with bipolar will have those particular symptoms of manic episodes, but those are some that can occur. Now, on the other side, some of the symptoms of the depressive episodes, including things like feeling really down or sad or anxious, feeling slowed or restless, trouble concentrating, maybe talking very slowly, or feeling like the person has nothing to say or that they're forgetting a lot of things, a lack of interest, or even the inability to do basic things. These symptoms are listed on the National Institutes of Mental Health website. The first thing I have to say as a family physician is that mental illness is not a crime. It is nothing to be embarrassed about, to be ashamed about. And it's something that should not be stigmatized, which is what we often see in this country and in places all around the world. We don't criticize a patient with cancer for having cancer, do we? We don't criticize somebody who's diabetic with high blood pressure for having those conditions, but oftentimes people who with mental illness are looked down upon or shamed or feel, for lack of a better way of putting it, they feel some kind of way about having mental illness. So the stigma and the shame has to stop. A lot of people ask, well, why does bipolar happen? We think it's a combination of how our brains are wired and genetics and perhaps other factors as well. The most important thing to understand is that mental health is very real, and mental health is just as important as every other aspect of our health and should not be shamed or stigmatized or judged. I always say, if you have symptoms that I've mentioned or other symptoms that you're concerned about or interfering with your ability to live your daily life, this is your time and your opportunity to talk to your doctor, to reach out for medical help. Guys, there are always solutions, and I should also say there are medical treatments for bipolar disorder as well. I hope this is helpful. Guys, please don't forget to share this video if you found it helpful, and don't forget to like and follow my page. I do daily health videos, and if you're interested in sending stars, I answer your questions first. Guys, I will see you soon.